Now, speaking of the vaccine, it has now been a week since the CDC gave the final okay to start giving those vaccines to kids under an emergency use authorization. As of today, the Idaho Department of Health and Welfare says more than 2,200 in Idaho have gotten their first dose. That's kids. And we've gotten a lot of questions since then, like this one here. If the kids 5 to 11, if the vaccine, is it only one shot or two? Well, it is two, just like the adult version, just a smaller dose. The 5 to 11 vaccine is 2 shots taken every 3 weeks, or taken 3 weeks apart, I should say. Dosage formulation is, well, it's a little different, just a third of the size. Good news, all pediatric offices in Idaho should have received their doses by today, if they haven't already. Pharmacies across the state are still getting theirs as well, so you can check before you go. But what can parents and families do for their kids who aren't old enough to get a vaccine, those under the age of 5? How can they be protected? During today's briefing, we also heard from Dr. Guillermo Guzman, an OBGYN at St. Alphonsus. He says he's seen several of his patients contract the virus, some sick enough to lose their baby, sick enough to go into premature labor, which in turn can affect their newborn baby and cause other problems. He reiterated what we've heard since the vaccine became available to the public. It is safe, and it is also safe for pregnant mothers, but also those who are planning to become pregnant and those who have recently given birth.
Think of the vaccine as a seatbelt. Seatbelts do not prevent car accidents, but they keep you alive if you do get into one. Likewise, you can still get COVID-19 after being vaccinated, but if you do get COVID-19, you are very, very much likely to survive if you do.
Not 100% like a seatbelt, the vaccine, but pretty darn close. Dr. Hahn, who we saw earlier, also reiterated there are no signs that the vaccine causes infertility, adding more studies are being done to prove that.